Hey guys, what's going on? This is Dr. Keuchel here, and I want to talk about ice versus heat. This is one of the main things I get asked about, especially early on after the first visit or after a new injury pops up is, hey doc, what should I do? Should I ice this? Should I heat it? How long should I do it? What do I kind of do to manage this in between visits? So, for me personally, I feel that ice can definitely be a beneficial tool to use between visits and especially early on within the injury process and within the rehab process. So it's a great alternative to taking anti-inflammatory medications such as ibuprofen or Aleve or anything like that, because when you ice it, you're going to temporarily constrict the amount of blood flow, so you can kind of control a little bit of that inflammation process so that doesn't get out of control. So we can still make sure that we're active and moving and doing the things that we need to do to promote that tissue healing. So the tissue wants to move, it wants to respond, it wants to work, even if it is hurt, because that's how it learns where it needs to send its stuff to actually help that tissue respond, grow back together, and come back stronger than it did before. So this paper talks about, I came across this paper as well, and it talks about should we put traditional cold therapy to bed? And what this paper is specifically talking to is more of that preventative or proactive approach to icing, where you'll see pitchers or different athletes icing up after their games or after their outings or after their workouts before they even really know how their body's going to respond to what they just did. They didn't have any sort of acute trauma, any kind of injury that happened that took place. They're throwing ice on to make sure that inflammation stays down. I feel that that is not useful. We need to stay away from that as much as possible. But when we have a true injury, or if we're trying to just kind of minimize some of the aches and pains that we have going on that are already present, then icing is a great tool to use instead of that anti-inflammatory process, because we are controlling the amount of swelling and the amount of blood flow to the area versus completely eliminating it and keeping all those growth factors from taking place and coming through the blood delivery system. So whenever I'm working through and having patients ice injuries, the way I like to utilize that is through a 4-stage process where we apply ice, and rather than just timing it specifically, we want to see how the body responds to it. So we want to go through a cold phase, it's going to turn to more of like a burning phase, an ache, and then it's going to go numb. Once we hit that numb threshold, we want to take the ice off, move around, do some light stretching or some light therapy, get some blood flow back into the system, help to pump out the old blood in that area, some of the inflammation, ice it again, and then repeat that 2 to 3 times, and at the end of the day. So that's when I would like to utilize ice, and how I would utilize it within the rehab system with a new injury or early on within care. This paper, the one thing that I did want to highlight within is how it talks about the utilization of cold therapy, how it can be something to manage the response to care and the inflammation process versus completely eliminating it and taking it away. So it is going to delay the amount of time it takes to recover if we utilize it often, just because we're diminishing the amount of time and growth factors getting to that area, as I mentioned before. But it's not something that should be tossed out completely or something that shouldn't ever be utilized. So I do like where this paper talks about that, but in general, where it talks about just the preventative approach of icing before we really know what's going on, I think that's a little bit old-fashioned. We should definitely avoid that. Wait to see how your body responds, see what's going on if you need to, as a way to manage your pain. Let's use some ice, let's get it calmed down, and then let's start moving and using our body as much as possible. So that's my take. That's how I utilize ice within care. Be on the lookout for another video utilizing heat and when heat should be utilized and how to maximize that therapeutic process. If you have any questions, feel free to reach out to the email here or to the office phone. Either way, I look forward to hearing back from what you guys think about this, and hope you guys have a great week.